Hi, Ayana. It's Sharon Beck. I thought it would probably be easier and maybe less time consuming for me to just make you a little video and tell you a little bit about what I thought about the Therapy Notes website. I actually liked it a lot. Yes, in answer to your first question, I think it'd be extremely useful in clinical practice. My practice is just signed a contract with Valent, which is similar to Therapy Notes. I kind of checked out both websites, and I think that we feel like it's definitely what's going to happen in clinical practice, and it probably needs to happen. Why? Because I think there are a lot of problems with paper notes that will be resolved with electronic medical record. The first, and this sounds ridiculous, but it really has been a huge problem that I've observed over the years, is legibility. Some of my practice partners, though they are wonderful people, write so messily that there's no way I can read it, even though the note is in there and right there for me to look at if I'm doing individual and they're doing marital or whatever with a couple, but I can't read what they've actually written to me, which is, for me to look at. I know with the typing on EMR that will be a huge improvement. At least we're hoping that it certainly will be. Do I believe that it will help to facilitate intersectional collaboration? Yes, I do, for that reason stated above. Also, though it's nice and important to stop and catch each other in the hallway, etc. I think a lot of times just having a note that's very clearly written and that follows a format can help in understanding what each other is doing with the patient, particularly with the medications. Looking at the EMR templates, it looked like at least the one that we're using, Valent, is going to actually have a place for symptom side effects that all the doctors will have to do is check off some of the needed, portions of whatever side effect the patient is experiencing. And I should suspect that the therapy notes will have that also. How will improve the client-patient experience? Well, that's a good question. I'm not sure that it will. That is the one thing that we have had patients, at least at the hospital where I am using EMR now, complain about, and that is that they cannot really, they feel like the practitioner is often looking at their screens rather than looking at the patient. Now, what I've done with that is try to, before I see the patient, quickly fill in the check boxes that I already know about that particular patient for that day, and then write my narrative note after I have seen the patient. Just take 2 or 3 minutes and write the narrative note and finish it so that it's very timely, but the person isn't feeling like I'm sitting there looking at the computer and not seeing them. What do I feel the role of mobile info technology is in evidence-based practice? Well, I think that everything that we can, according to our book that we read, and I forget the name of it, but the one about the guy that worked for Sprint, that started Sprint or something, that guy, I think he's right that anything that can be made mobile ought to be made mobile, and that will help us a great deal in being able to do what you need to do from any place that you are at. I certainly think point of care, to have things like Epocrates or some of the other websites that people have come up with in our class this time, that we can use, Dynamed, for example, that we can use to get information quickly about what the most current research is going to help people. And certainly it helps if you don't have to wait until you're back at a stationary computer to do so. Social, ethical, or financial costs of using mobile technology in the workplace. Well, I can tell you that we're just adding $3,000 a month by using our new Valent system. We will be, as soon as it is rolled out next month. And of course, that's a huge issue. It is going to add to the cost. We are hoping, however, that some of that cost will be made up by the way that we are able to bill quickly, get the idea of, of our aging reports easily, and that some of the office work will make up for some of that extra cost. I hope that's really true. We'll see. Ethically, I think we all have to be horribly careful about HIPAA protected and well encrypted technology, and that's going to be something that we're really going to struggle with, I suspect, as people learn to hack into these systems. I like Epocrates in terms of technological resources that I have used in the clinical setting. And, as far as I'm concerned, we're just getting started. I'll probably know more in a month or so after we've rolled out the Valent. But that's my thoughts on it for now, Ayana. I hope this is somewhat helpful. Take care of yourself and good luck in getting yours done. I'm still working on mine.